Understanding dementia is like embarking on a journey of the mind. Dementia is not a single disease, it's actually a group of conditions. These conditions affect the brain, impacting memory, thinking, and behavior. Over time, everyday tasks become more difficult. Imagine a library where books are scattered everywhere. You can't find what you need. That's similar to how dementia affects the brain. Information gets disorganized, making it hard to remember, learn, and think clearly. Dementia is progressive, meaning it gets worse over time. The speed of progression varies. Some people live with dementia for many years. Dementia is a serious condition, but there is hope. Early detection and support can help. We can improve the quality of life for those living with dementia. Dementia is often called a silent thief. In the early stages, the signs can be very subtle. They might be mistaken for normal aging, which makes early diagnosis a challenge. For example, forgetting a name or a recent event can happen to anyone. It doesn't always mean dementia, but when these memory lapses become more frequent, it's a warning sign. Another challenge is that dementia affects people differently. There's no one-size-fits-all symptom list. This makes it even more important to be aware of subtle changes in yourself or your loved ones. Early detection is crucial. It allows for timely intervention, including medical treatment, therapy, and support services. Early detection helps individuals and their families cope better. Dementia can manifest in various subtle ways. One early sign is difficulty finding the right words. A person might struggle to recall common names or objects. They might use vague phrases like "that thing" instead. Changes in mood and personality can also be indicators. A normally outgoing person might become withdrawn and apathetic. They might experience unexplained sadness, anxiety, or irritability. Another subtle sign is difficulty completing familiar tasks. This could be something as simple as following a recipe or using a phone. They might also struggle to follow conversations or lose track of time. It's important to note that these symptoms can be caused by other factors such as stress, medication, or depression. However, if you notice any of these signs, it's essential to consult a doctor. Section 4. Recognizing the signs, real-life examples. Let's look at some real-life examples. Imagine a woman who always loved baking. Suddenly, she finds it hard to follow her favorite recipe. She forgets ingredients or mixes them in the wrong order. Or consider a man who was once a skilled handyman. Now, he struggles to assemble a simple bookshelf. He gets confused by the instructions and can't seem to complete the task. These are just a few examples of how dementia can impact everyday life. It's important to remember that these changes are not a sign of weakness. They are caused by changes in the brain. If you notice these signs in yourself or a loved one, don't ignore them. Talk to a doctor. Early diagnosis and treatment can make a big difference in managing the condition. Section 5. Early detection, a beacon of hope. Early detection of dementia is like finding a lighthouse in a storm. It provides direction and a sense of hope. While there is no cure for dementia, early diagnosis offers several benefits. Firstly, it allows for timely medical intervention. Medications and therapies can help manage symptoms and slow down the progression of the disease. This can extend the period of quality life for the individual. Secondly, early detection provides an opportunity for planning for the future. Individuals can make important decisions about their care, finances, and legal matters while they still have the capacity to do so. Thirdly, it allows families to come to terms with the diagnosis and seek support. Support groups and counseling can provide emotional support, education, and coping strategies for both the individual and their caregivers. Early detection empowers individuals and families to navigate the challenges of dementia with greater knowledge and resources. Section 6. Taking action, the power of proactive care. If you suspect dementia, don't wait. Talk to a doctor. They can assess the situation, rule out other conditions, and recommend appropriate steps. Remember, you are your own best advocate. Being proactive also means educating yourself about dementia. Understanding the condition, its progression, and available resources can help you make informed decisions. Support is available. Connect with local organizations, support groups, and online resources. Sharing experiences and learning from others can be incredibly empowering. Remember, there is hope. With early detection, proper care, and a supportive network, individuals with dementia can live fulfilling lives. Thank you for taking the time to read this. Knowledge is power. Continue to learn about health topics that matter to you and your loved ones.